Good morning. This is section 3 of Pathophysiology, Cellular Injury and Disease. I only have a very few amount of slides to use today. We're going to recap a little bit of what we've talked about in the last 2 sessions and maybe give you a little deeper understanding of the Krebs cycle and the cellular process. So to start out, just want to remind you there are certain things that are important to the survival of cells and to the survival of tissues. And there are certain things that are important for you to understand about disease processes and how these affect the ability of the cells in their daily function. One of the things you need to understand is the way cells and tissues, which are made of cells, will react to injury, structurally and functionally. Cells are designed to survive. We've said that before. They have what's called environmental adaptation. An example of an adapted cell would be an increase in the amount of red blood cells available for somebody who lives in a high altitude. They make more red blood cells because there's not enough oxygen in the atmosphere, so they need more of an ability to transport that gas. Cell atrophy is a decrease in size, and you'll see that most commonly in your geriatric population. When you don't use a muscle anymore, it'll shrink. So as the muscle shrinks on the cellular level, what's occurring is the cell itself that makes up that muscle tissue, those cells are actually shrinking. Hypertrophy is an increase in muscle size, or actually just an increase in the size of cells. But what comes to mind when I hear hypertrophy is enlargement of the heart. A lot of times this can occur because if there is a lung disease process, COPD, for example, the heart is a muscle just like any other muscle, and the more you use it, the bigger it's going to get. Hyperplasia is an increase in the number of cells in an area. I used to work for an oral surgeon, and one of the things we saw commonly was gingival hyperplasia. What that means is there was an excess amount of gum tissue, and we had an excess amount of gum tissue because we had an excess amount of cells that make that type of tissue. And the reason for that increase was usually someone who had a history of epilepsy and they were taking Dilantin. One of the side effects of Dilantin is gingival hyperplasia. You can also have hyperplasia in other cases, but basically the difference between hypertrophy and hyperplasia, hypertrophy means an increase in the size of the cell, and hyperplasia means an increase in the number of cells. Metaplasia is a change into an abnormal form for a particular type of cells. An example of metaplasia would be the bronchial lining. You know, the cells that line your bronchial pathway should have cilia, and the cilia catch foreign particles. Someone who, for example, is a smoker, their bronchial cells would change so that there is no longer cilia. That is metaplasia. It's a change in the cell. We're still having epithelial cells, but they no longer have the cilia. Dysplasia means dysfunctional. It's an abnormal change in a mature cell. A lot of times you're going to see this as a precursor to cancer. So if you hear the term dysplasia, just keep in mind that this is probably something that is not normal, and it can refer to cancerous lesions. So with cellular injury, this is usually caused by narrowing of arteries or by plaque buildup. Cells need adequate oxygen in order to perform their daily functions. Without it, they can't maintain ion pumps that move sodium and potassium and magnesium and calcium and chloride. A lack of oxygen can cause cellular swelling, and we know that once a cell swells to a certain point, it can rupture, it can lyse, L-Y-S-E, lyse. We also have chemical injury to cells, and there are some drugs and toxins that affect your cell membranes. Anything that damages the plasma membrane can lead to increased cell permeability. What that means is what we just talked about. You have that chance of cellular swelling. You also have irreversible cellular damage. Cells need an adequate amount of oxygen to perform their daily duties. And any kind of injury can decrease that ability. With infections, injuries, you have bacterial infection, viral infection. Bacteria can produce endotoxins and exotoxins. So exotoxins are excreted, and endotoxins live within the bacterial cell wall. Either one of those can damage the body cells when they're released. Endotoxins would be like meningitis or gonorrhea. Those bacteria produce endotoxins. And endotoxins don't cause the body to produce strong antibodies. That's important to remember. Endotoxins do not cause the body to produce strong antibodies. That's why it's hard to get a vaccine against those bacteria. Endotoxins alert the inflammatory system of the body, and because of that, they are called pyrogenic organisms. Pyrogenic simply means it's going to cause your body to have a fever. Hypersensitivity will develop on the second exposure of a toxin. So you can be exposed to something and it not be a problem. The second time you're exposed, it can be a life threat. So hypersensitivity reaction is an immunological response that occurs when the first exposure. Hypersensitivity develops the next time you're exposed to that toxin. On page 235 of your book, you'll notice an orange block. It tells you about bacteremia, and it would benefit you to read that before the next lecture. Basically, it tells you when your body's defense mechanisms fail, then these bacteria can multiply in your bloodstream. You get bacteremia from that. You can develop septicemia, and we know what happens when you are septic. It causes vasodilation. It causes a decrease in venous return. It causes a shift in fluid from the intravascular space to the extracellular spaces, and an increase in an inflammatory response, which means also a decrease in oxygen available to the cells. So here we're talking about the immunologic inflammatory injury process. Phagocytes can damage even healthy body cells, and they don't discriminate. Phagocytes are responsible for cleaning up ruptured cells or damaged cells. So once they're activated, it triggers a very strong immune response. And I want to back up here. I didn't really cover viruses as fully as I wanted to, I want to tell you that viruses lack the things that bacteria have that allow them to grow rapidly and multiply. The only way a virus can multiply is by invading another living cell. Viruses, they either contain DNA or RNA, but they never contain both, and that's why they have to invade other living cells. And the way that happens is the cells notice the virus and they will engulf it. What happens is the virus, the wall of the virus itself, once the virus has been engulfed, that wall will disintegrate, it'll break apart. And once that happens, then its genetic material will take over that of the normal cell, and that is when the virus starts to replicate. Viral infections, too, are easier to prevent than they are to treat. And prevention, we know 90% of that comes from hand washing. Okay, so back to your immunological and inflammatory injuries. So what happens is your cell membranes get damaged, right? So they'll get damaged, and then that creates an inflammatory response. That sets off your complement cascade, the complement system, and basically what happens with the complement system is you have a release of antibodies, lymphocytes, macrophages, and they all get released. And if the cell membrane is injured, or if the transport mechanism, in other words, the sodium-potassium pump, is damaged, then intracellular water levels increase. That's going to cause the cell to swell. If the swelling continues, then the cell will rupture, and then you'll need phagocytes to come and clean up that mess. So genetic factors with cellular injury. Genetic disease results from a chromosomal abnormality or a defective gene, and sometimes they're just spontaneous mutations. If something is considered congenital, that means that it was present before birth, which means it's genetic. Congenital. Genital refers to genetics, con means with, so it came with the gene. Genetic diseases result from chromosomal abnormalities. Sickle cell anemia, okay, would be one of those things. That's a genetic defect. An example of a spontaneous mutation would be Down syndrome. Some of the genetic disorders can alter how the cell works, and an example of that would be muscular dystrophy. So overnourishment is just as bad as undernourishment. We need to remember that. Cells need these things. They need water, glucose, and protein in order to survive. Too much or too little can alter the normal work of the cell. A lot of time, physical agents can damage your cells and your tissue. Hypo or hyperthermia, blast injuries, decompression illness, radiation injuries, skin cancer, hearing loss, or overuse syndrome. And those last two, hearing loss and overuse syndrome, those are pretty common in the EMS field. So these types of things can contribute to cellular injury. An injured cell may show different types of abnormalities in its form and structure. These abnormalities are considered morphological changes. The most common are cellular swelling and fatty change. Both changes can show local or systemic patient changes. And let's look at this just a minute. A lot of these things listed on these slides refer to the liver. So we said fatty change occurs when the enzyme system that metabolizes fat is impaired or it's overwhelmed. It's common in your liver cells because these cells are actively involved in the metabolism of fat. Because injured cells can't rid themselves of excess uric acid, bilirubin, and melanin, and etc., the products accumulate and they cause irreversible cell damage or cell rupture. Then you have macrophages that circulate in the blood, while phagocytes are sent out to injured tissue areas. As the phagocytes accumulate in an area, you'll notice swelling and redness, and an unusually large accumulation of macrophages and phagocytes can cause liver and splenic swelling because those pathways get clogged up. Fatty changes occur when the enzyme system that metabolizes fat is impaired or overwhelmed. Lipids gather in the cells. If you've ever heard the term fatty liver, you know that's what this is. A common cause, but by the way, not the only cause, but a common cause of fatty liver is alcohol abuse. Fatty liver is also a precursor to liver cirrhosis. Something else, patients who are on long-term medications that filter through the liver system, those patients are also at risk for fatty liver. And once cellular injury has occurred enough to affect tissues, and we know tissues make organs, then you're going to have a systemic manifestation of the problem. So that tiny little cell that has a tiny little problem, if it is system-wide, if it's tissue-wide, then you're going to notice a systemic change. And your systemic manifestation is going to be fever, loss of energy, lack of motivation, apathy, appetite change. If they're septic, they're going to maybe be tachycardic, abnormal rise in white blood cells, maybe pain to an area. And this is all due to cellular death and necrosis from cellular injury. So cell death occurs when the cell's normal function has been disrupted for such a period of time that it goes into anaerobic metabolism. Cellular aging and death are common. It's a natural process in the cell cycle, but as the cell ages, it becomes less efficient in executing its functions. It's also more at risk for damage from harmful environmental agents. With progressive damage, a cell loses its ability to repair itself, and in time, it'll begin to malfunction. Changes in immunological cells slowly lead to decreased immunity and an increased risk of infectious disease. Malignancies increase with age as a result of decreased immunity. This is also due to an increased incidence of malignant transformation of various cells. Other examples of manifestations of aging in cells include gray hair, reduced muscle mass, menopause, arteriosclerosis, memory and vision impairment, and arthritis. And if you will look in your book, Mosby, page 237, box 11.7, that'll give you some normal cellular aging. Hypoperfusion is decreased circulation of blood and nutrients to tissues and organs. It's usually caused by a decrease in cardiac output. Cardiac output is also known as cardiac minute volume, and you're going to want to know this formula. Cardiac output equals heart rate times stroke volume. And I'm sure you've heard that in your EMT class, but it's going to be extremely important through this program as well. Negative feedback is basically anything that brings balance to body changes. An example of negative feedback is your parasympathetic nervous system. It brings things back to normal. Also, your spleen will release stored blood in the event of low circulating volume. That's another example of negative feedback. Pressure changes are detected by baroreceptors. Chemistry changes are detected by chemoreceptors, and it's important that you understand that. So chemistry changes like your pH balance are detected by chemoreceptors. Baroreceptors detect pressure changes. When a baroreceptor stimulation ceases because of a fall in arterial pressure, the negative feedback mechanism evokes several cardiovascular responses. One of those is going to be your vagus stimulation, and that is also considered parasympathetic. It's also going to result in an increase in heart rate and stroke volume. So chemoreceptors are located in the carotid and aortic bodies. And when your partial pressure of oxygen changes or your pH balance decreases, chemoreceptor cells stimulate vasomotor response in the medulla. Blood flow to the vasomotor center of the medulla can be reduced enough to cause ischemia. When that occurs, neurons in the vasomotor center become excited. This raises the arterial blood pressure. And with hormonal mechanisms, stimulation of the adrenal medulla is directly proportional to stimulation of the sympathetic nervous system. Epinephrine and norepinephrine are secreted. Your heart rate, stroke volume, and vasoconstriction are all increased in this instance. The renin-angiotensin-aldosterone system is an important regulatory loop, and we've discussed it. We're going to talk about it again because it's important for increase in blood pressure in circulatory shock. It takes about 20 minutes to become effective in hypovolemia caused by hemorrhagic shock. It'll remain active for about an hour. When your blood pressure drops or when there's an increase in serum osmolality, then the hypothalamus tells the pituitary gland to release antidiuretic hormone. And by the way, your antidiuretic hormone is vasopressin. This acts directly on the blood vessels, causing them to constrict, and it also causes less urine output to keep more circulating volume. Your venous sinuses in the spleen hold about 300 cc's of blood. When your baroreceptors notice a drop in pressure, the spleen will release your stored blood from circulation. And it's a negative feedback mechanism. So remember, we've said before we have these 5 types of shock: hypovolemic, cardiogenic, neurogenic, anaphylactic, and septic. And hypovolemic can be caused by hemorrhage or dehydration. Cardiogenic shock is the pump problem. Neurogenic shock would be due to spinal cord injury. Anaphylactic shock would be a hypersensitivity reaction. A septic shock would be a systemic bacterial infection. Regardless of which type of shock it is, inadequate tissue perfusion is the problem. So vascular endothelial tissue becomes permeable after cell damage. Once the plasma cascade system is activated, it causes an inflammatory response. The complement system then activates phagocytes, which cause more swelling and cell damage. This is the kallikrein-kinin system. And the kallikrein-kinin system releases a vasodilator called bradykinin, which we talked about the other day. At the end of the process, the patient has a hyperinflammatory hypercoagulation response, and that will lead to low blood pressure, edema, and clotting abnormalities. To make up for the decrease in blood flow, the heart speeds up, and then normal blood pathways are altered. And all of this causes too much blood in alternative pathways. Remember the thoroughfares we talked about? That will cause congestion. Then you're going to have clots form in the capillaries, and this decreases perfusion and delivery of oxygenated blood to vital tissue. So then we have multiple organ system dysfunction. Now, glucose is the key fuel for energy production. The byproduct of glycolysis is pyruvate. In anaerobic metabolism, the pyruvate converts to lactic acid and cannot enter the Krebs cycle. In aerobic metabolism, pyruvate moves into the Krebs cycle as pyruvic acid. In the Krebs cycle, the production of ATP is efficient. ATP is an energy molecule. Without oxygen, glycolysis, which is burning fat, is the only way to get glucose to cells for energy. So when your body is in aerobic metabolism, it is 18 times more efficient than when it's in anaerobic metabolism. And I'll just give you a little example. When your body is in aerobic metabolism and it's using ATP, then it will make 36 ATP molecules for the cells to use as energy. When it's in anaerobic metabolism and it's burning fat, it can only make 2 energy molecules for cells to use. So 36 molecules or 2 molecules, which one would you rather have if you were having to work hard? So what that means essentially is a significant amount of lactic acid builds up in the cells because of anaerobic metabolism and burning of fats, and that causes increased permeability in the membranes, which means we're going to have a fluid shift, and that means we're going to have cell damage leading to cell death because our sodium-potassium pump is affected. Sodium is going to go into the cell, potassium is going to leave the cell, and if sodium goes in, that means water is going to go in, that means the cell is going to swell, and then it's going to explode and die. That is basically the Krebs cycle. Now I know we're going to cover a little bit more in this than what you were assigned to read, but hopefully it'll help you with your next reading assignment. So there are basically 3 types of responses. We have cellular response, vascular response, and phagocytosis. Autoimmunity is an immune response against the body's own cells. And an example of that would be lupus. That is an autoimmune disorder. Isoimmunity is an immune response against beneficial foreign tissues, like blood transfusions or tissue grafts. Immediate hypersensitivity is when antibodies that are in a serum cause an antigen-antibody response upon re-exposure. It can be as mild as hives, or it can be as severe as anaphylaxis. Delayed hypersensitivity is when the body doesn't react for hours to days after an exposure. So we have immunity immunoglobulins, and that's always a hard word for me to say. And I want you to remember this mnemonic, GAMED, G-A-M-E-D, for immunoglobulins. And believe it or not, immunoglobulins are going to be on your National Registry exams. You're going to want to understand how they're working. So for these immunoglobulins, IgG means that it crosses a placental barrier and it provides temporary immunity to neonates. IgG crosses a placental barrier and provides temporary immunity to neonates. IgA defends body surfaces against invaders. IgM increases production of IgG in acute infections. So IgM is the helper to IgG, and IgG crosses the placental barrier. IgE is responsible for immediate hypersensitivity reactions. And IgD, well, we're not sure exactly what it does, but we know that you have an IgD immunoglobulin. So we also have what's called acquired deficiencies. And these are classified as either nutritional, iatrogenic, trauma deficiencies, or stress deficiencies. You also have what's called acquired immune deficiency syndrome, which is kind of the catch-all. And let me just kind of define these a little bit for you. Nutritional deficiencies would be like you have poor protein intake, or you have a reduction in caloric intake. In other words, you are malnourished. Iatrogenic deficiencies are usually caused by some form of medical treatment, and that is where you are suppressed. Okay, a lot of your patients who have autoimmune disorders are iatrogenically deficient. Trauma would be not necessarily an injury trauma, but cellular injury is considered a trauma deficiency. Like a bacterial infection, it can even be a burn. Deficiencies caused by stress can cause a depressed immune system. And on page 248 in your book, I want to bring you to the orange box there. Acquired immunodeficiency syndrome currently is the best known example of acquired dysfunction of the immune system. The human immunodeficiency virus causes AIDS. It results in debilitating illness that is manifested by various opportunistic infections and malignancies. Until recently, these were almost always fatal. The disease was first identified in 1981, and since then has become a global health problem. It affects an estimated 33 million people worldwide. And if you want to read more about AIDS, you can go to chapter 28 in your book. I'll tell you a little bit more. So acquired deficiencies are not the only thing that cause problems for us. We also have stress. And you as paramedic students, right now, you're going to start feeling a lot of stress and pressure. You have jobs, you have your studies, you have families, and I'm sure many of you have other things going on that require a lot of time. So here's a big word for you, and I want you to remember this: psychoneuroimmunology. Psychoneuroimmunology. And this is kind of the buzzword right now, and something that I'm a little bit interested in. It is the study of the three-way interaction between emotional state, the central nervous system, and the body's defense against external and abnormal cell division. If you've ever been under stress and you've developed hives, raise your hand. Well, that would be me. I've had hives from stress twice in my life, but I've had hives. They were not pleasant. Psychoneuroimmunology is the study of the three-way interaction of the emotional state, the central nervous system, and the body's defense against external infection and abnormal cell division. Stress will cause your adrenal glands to release catecholamines and cortisol. And I will just tell you now, cortisol likes to settle around your midsection. If you look around, especially in EMS, you'll notice a lot of people, they kind of have that little spare tire starting to form. That is because of an increased release of cortisol And like I said, cortisol likes to settle around your midsection. These things also cause the pituitary gland to release antidiuretic hormone. So then what you have is puffiness and immunosuppression. So if you are stressed, your body's going to release catecholamines and cortisol, and it's going to make you puffy and, unhappy. It's also going to make you more susceptible to diseases. Oh, let me back up one. Okay, so what we have here are different inflammatory responses. We have mast cells, which in their cytoplasm is filled with granules that contain these little things called amines, A-M-I-N-E-S, amines. When mast cell tissue is injured, the mast cells will drop these little amines. I like to think of them in my mind as a bomb. So when a mast cell goes to an injured tissue site, it will release amines, which will cause histamine to flood the system. This activates the inflammation response. So acquired immunity is when you have an exposure, and this can be an exposure through a vaccine, and immunogen is an antigen that causes the formation of antibodies. And it's a way that you can remember that. Type A has an anti-B antibody. Type B blood has an anti-A antibody. Type AB blood has neither antibody, and type O blood has both A and B antibodies, but no antigens. So who's the universal donor here? And who is the universal recipient? Rh factor is located in your erythrocytes, and if there's a mismatch, it can trigger an immune response. The erythrocytes is the red protein that causes red blood cells to be red, basically. And I want to move on to genetic factors and just talk about this just a little bit. Genes are not unchangeable units of inheritance. In some cases, they can be affected by environmental influences. If you think about sickle cell anemia and malaria, and some of you may have heard about this before, in most instances, the highest concentration of people who are going to be prone to sickle cell anemia live in areas that, ironically, have the highest risk for malaria. And the way malaria works is it has to have those red blood cells. It has to have good, healthy red blood cells. Well, if you have sickle cell anemia, you do not have good, healthy red blood cells. So the irony here is sickle cell anemia, people who have this genetic problem are less likely to develop malaria. So it's sort of a natural immunity to malaria. And this is a case of prevalence as a result of natural selection. And I find things like that ironic and interesting. And if you would like to read more about it, page 251 in your Mosby text will tell you. There's box 1114 on the bottom of that page will tell you more about malaria and sickle cell disease. So with disease rates, incidence refers to the number of new cases detected. Prevalence refers to the number of people living with disease in measured population. Mortality will refer to the number of deaths in a population surveyed. Causal factors are those where risks are removed and disease is eliminated or prevented. Non-causal factors are those that can predict a person's chance of developing a disease. Factors that can Cause disease are complex. They may involve genetic or environmental factors, or they can involve a combination of both. And I know we went a little further than what I told you to read, and I'm going to recap on Wednesday and backtrack on those things and catch us back up. But I just kind of wanted to give you a little preview of the things we're going to be focusing on for day 4. We're going to start on page 242, self-defense mechanisms, and that'll be your Wednesday lecture. I'm also going to recap the Krebs cycle, the sodium-potassium pump, and water movement. I'm going to leave you today with this quote from Richard Seltzer from his book, Letters to a Young Doctor. You cannot separate passion from pathology any more than you can separate a person's spirit from his body. And so today, I hope you enjoy your President's Day, and I will see you